So Hind, you probably, yeah.
There's more people coming. Is it popping up for you, that people who are in the waiting room? Because it's showing, okay.
Yeah.
Okay. I see them now. Just to make sure.
Okay. Thank you everyone for joining. We are very happy to continue the series of education and collaboration for the youth community with the leadership of Dr. Amani and Arij. So thank you for your work. Today we have another exciting session for you. I'll turn the mic for Dr. Amani to say a word, and then we'll turn it to Arij, and then for our host. And thank you for making the time today. It's really appreciated.
Thank you for having us.
Hello, everyone. Thank you very much for driving this initiative and just make it real and happen. I know this at the beginning of this year, we start the road to university with an ambition that we're gonna just like start the road to the people who are willing to pursue higher education, university education for the youth and even for the adult. And I'm really glad that now we're seeing you as a youth starting in this and engaging in this initiative. So thank you very much. Just a quick introduction about myself. I'm Mani Babikir. My background is in microbiology. I have master and PhD here from the US, and I work as a lead microbiologist in Ecolab, but I'm really passionate about science and very biased to biology and any disciplines that in that track. So thank you very much for being with us today.
Thank you. And my name is Arij Wadia. I'm currently a fourth year dental student at East Carolina University. And more importantly, I'm part of the Sudanese community in Greensboro. I really enjoy mentoring our youth and providing them with opportunities that we wish we had. But particularly, I'm interested in exposing them to different careers in healthcare. So that's been a passion of mine. And I really want to show my gratitude to Dr. Khalid and Dr. Amani, especially for providing the platform for me to do that. So I've become part of the Sudan House Education Committee. And, you know, I've been kind of rolling out sessions, having different speakers each time who are, you know, in healthcare fields, but specifically they're Sudanese. And I think that's really important for us to provide that representation. And I think we can connect with our own on a different level, and just to also provide an opportunity for these speakers to be mentors to our youth. So thank you all for joining. And I definitely want to show my gratitude to our speakers who have put so much effort into the session and have taken time out of their busy schedule to come and talk to us and share all the knowledge they have, and advice for anyone who is interested in pursuing a career in pharmacy. These individuals are also connected to North Carolina in some way of fashion, whether they were raised here or they were born here. But that's also kind of been one of my mission, is to find somebody who's North Carolina. That way, the information is not just informative, but it's also relevant to our youth. So thank you, Dr. Suha. Thank you, Hind, for joining us, and I'll let you guys introduce yourselves.
All right, thank you for having us. My name is Dr. Suha Ahmed, and I am a pharmacist, specifically an industry pharmacist. I was raised in Greensboro, so I have a lot of ties to North Carolina, and I'm glad we have this opportunity to introduce pharmacy. Me and Hindoya, we're both in it. She's a pharmacy student right now, and I just recently graduated not too long ago, so we're glad that we can put something together to help the youth in Greensboro and beyond.
Yeah, same here. Hi, everyone. I'm Hind. I am a second year pharmacy student, currently active in my second year. And I was in North Carolina for a few years, around like 5 years or so. So I'm really happy to be here and help you guys or introduce something to you guys and hopefully inspire you into something new. Okay.
Thank you guys. And if the participants can unmute and just briefly introduce yourselves, that would be awesome. And if not, that's okay. We can continue with the presentation.
Okay, so I wanted to start by giving an introduction just about my background, my experience, how I ended up in pharmacy school, just so I can just give a little background pretty much about how I got to where I am now. So I did graduate in 2023, so not too long ago from pharmacy school. Before that, I attended undergrad at NC State, where my majors were biology and psychology. And while I was at NC State, I had the opportunity to study abroad. So I did attend the University of Copenhagen for about 7 months. And that was just an incredible experience. I got to travel throughout Europe, meet a lot of different people in different fields, mainly people in the biology, chemistry, psychology fields. So that was a great experience for me. And then right after I did my 4 years of undergrad, I went to Northeast Ohio Medical University. And that's where I continued my 4 years of pharmacy school. I did have a good amount of work experience where I like
MashaAllah, hareti ay maad lakin anaga. Di mabitiyahan.
Salam.
Sorry about that, Inayat.
So I actually did a ton of leadership and work experience that helped me get into pharmacy school. So one of the things that I did was in 2018, I founded and was a director of the International Festival at NC State. So with that, it was just pretty much an effort to promote inclusivity and diversity at a time where the campus environment wasn't the best pretty much during the elections. And it was, NC State is a predominantly white institution. So me and a friend had initiated the International Festival and directed it. And we were able to secure funding from the North Carolina Board of Education. And now the university leadership actually really liked the event so much that it's still an event that's continuing on this day past my time at NC State. So that was a good amount of leadership experience that I think helped boost my admissions to pharmacy school. And additionally, I did work at a retail pharmacy. I worked at multiple retail pharmacies. So I was a pharmacy technician at CVS, at Rite Aid, and Walgreens. So I got to know what the pharmacy field looked like, but I just didn't know how vast the field was and how fast it was expanding. So as I got into pharmacy school, that's when I learned about different career options in pharmacy. And then additionally, during undergrad, while I was working as a pharmacy technician, I also worked at the chemistry office, which fit perfectly. So I did have a good amount of experience in both chemistry, biology, psychology, and just some international travel that helped me become a well-rounded individual for interviews. Okay, and that's pretty much about me. I'll pass it on to Hindoya for her introduction.
Okay. Hi, everyone. So I kind of started with, I did biology at Towson University. It's in Maryland. So I did my bachelor's degree there. I kind of went through that path because I kind of wanted to be more open with my options because biology kind of fits into most of the the healthcare field. So I started off with that. And while I was doing my bachelor's degree there, I did some pharmacy technician work with Walgreens for a few years. And then I did work in a hospital. I didn't really do much experience, but as much as Suha did before pharmacy, just kind of expose myself into the field and see what it was like with the retail and the hospital. They're very similar, but a little bit different at the same time. And just like Suha said, I didn't know how big pharmacy was until I came into pharmacy school. And that kind of like solidified it for me that I want to keep going into this, and we'll tell you guys a little bit more about it today. And I go to VCU, School of Pharmacy here in Richmond, Virginia. And I'm in my second year, as I mentioned earlier. And yeah, I'm glad to tell you guys more about this today so you guys can have a better idea of what pharmacy looks like so you can know if you're into it or not. Okay.
So we just have the agenda of things that we're going to cover throughout the presentation. We're going to start by talking about the different careers for pharmacists, what options you kind of have, the core roles and responsibilities of pharmacists, the impact of pharmacists in healthcare, education and licensing requirements. And I did go into, I saw there was a question about how foreign graduates can become licensed here in the US. So I wasn't personally familiar with that process, but I did get a chance to look into it, and we're going to talk about that. And then Hindoi is going to talk about some study materials that she has, and she's going to just present some stuff just so you can get the gist of the workload and the material that you'll be studying with. The application process will also be reviewed, which is, I'm glad we have Hindoi here because when I applied for pharmacy school, that feels like ages ago. So I'm glad that she recently applied. So everything is probably fresher in her mind than it is in mine. And then just why pharmacy and the benefits. And we're going to talk about pros and cons in addition to any advice.
Yes. Okay. Is it moving?
We're still on the
Okay.
agenda slide. Yeah.
Okay, there we go.
Yeah.
So we wanted to start off by asking you guys, what do you think the role of a pharmacist is, just to get an idea of how much you guys know? If anyone wants to share.
Prepare medicine, different formulas.
Okay.
They answer questions that like patients have about their medications when they do have questions.
Yeah. Okay.
We can say that, for an example, the clinical pharmacist is responsible for making sure that the adverse effects of the drugs does not affect the patient himself by having other diseases, for an example.
Mm-hmm.
Yeah. Mm-hmm. Anything else? Okay, so you guys kind of touched onto the good main ideas of what a pharmacist does, and the clinical one is a little bit more than what I expected to hear about. So we'll share more about that, and so how we'll explain a little bit more here for us.
Yeah, so last month was American Pharmacist Month. So this is an infographic that they put together. So the data here is pretty recent. So there's 340,000 pharmacists in the US, and they play a pretty big role in the healthcare of the US system. So whether that be through vaccinations, immunizations, I know during the COVID pandemic, pharmacists really stepped up and took a huge responsibility and role in vaccinating the nation. And they're actually expected to have more responsibilities coming in because there is a shortage of primary care physicians in the US. So as time goes, and I've seen this, I would say that more pharmacists are taking more clinical roles whether it's testing for different health illnesses, or just making sure that the patients are taking their medications and any immunizations on time. Pharmacists have really stepped up with that, in addition to actually also having the opportunity to start vaccinating kids, which was typically reserved for pediatric offices, but now pharmacists have more of a big role with that. So in impacting with public health, 6 in 10 adults have a chronic disease in the US. So a lot of the times, pharmacists are the first point of care, especially for uninsured and underinsured patients. So we see patients that from very different backgrounds that have either no insurance or not really good insurance, but they need something to kind of help them quickly. So with that being said, we test and treat COVID, RSV, HIV, the flu, strep, STIs. They have a pretty vast role in the immunization process. Additionally, there's different types of pharmacists. So you can be responsible for pain management, for, I know I worked in my rotations, I had a lot of experience. So I did the NICU, so the neonatal intensive care unit. So I worked with little premature babies. Seeing the pharmacist's role in that was very, very interesting, because you don't really think about that. But when you're in that field and you're dealing with that every day, you're kind of seeing like how important the pharmacist is, because babies really can't handle error, especially being that young. So pharmacists have played a huge role in just different specialties overall. And in terms of education, we're going to talk more about this later on, but it's typically 6 years at least, that being a minimum of 2 years for the prerequisites, or you can just get a degree, like the full undergrad degree of 4 years, and then the 4 years of pharmacy school. And yeah, that's pretty much. And do you want to add anything?
You kind of covered it for this slide, yeah. We can go into more like about where the different careers of pharmacy, just to kind of add more to that. There's honestly so much more than you guys think there is out there. But these are kind of the biggest fields of pharmacy and ones growing right now. We have community, which is more like retail at CVS, Walgreens, Rite Aid, all those places. So your typical pharmacist, but it could also be different in the sense of like being more involved with the community for people, or like places where people have less insurance or no insurance and no access to healthcare. So pharmacists can be involved in that sense through organizations and stuff like that. So they do community outreach. And we have hospital, where it's more of like outpatient pharmacies in the hospital where they dispense medications as well. And clinical is more like pharmacists who work with a team in the hospital with doctors and stuff like that. So it's more hands-on and more patient-focused. And there's also the industry side, which is more like, how do I explain it? Marketing or regulatory stuff for drug companies, and more research involved. There's also veterinary, which is new. I didn't even know that existed until I came into pharmacy school. And managed care as well, which is also kind of more community outreach focused as well. And I see it growing more now than I did before. And compounding. So there is a little bit of compounding that happens in like pharmacies like Walgreens and CVS, but there's also special pharmacies only for compounding, where they mix special medications for specific patients and specific needs. So that's pretty cool as well, if you're more into the mixing and getting creative too. sometimes they can be creative with it. And nuclear, I'm not really like well informed on what nuclear pharmacy is like. So if you know anything about it.
Yeah, so nuclear pharmacy is pretty much dealing with radioactive material, specifically like different radioactive material for imaging or like chemotherapy agents, anything that requires any radioactive materials, nuclear pharmacists would deal with. I will say they have to do additional training. I think it's like 500 more hours. I'm not sure. Don't quote me on that, but I think it's like 500 more hours where they have to do training specifically on nuclear pharmacy. But it's a growing field. I know one nuclear pharmacist, and she loves it. So I think the hours are like graveyard shifts though. But other than that, she loves it.
Yeah. And also for most of these after pharmacy school, you would have to do something called a residency, like clinical pharmacy. I know you have to do a residency. Can be sometimes from 1 to 2 years based on which residency you want to go into. And these residencies can get you more specialized in, like, there's oncology pharmacy, cardiology, geriatrics, pediatrics. What else is there? There's so much, almost, yeah,
Any ambulatory like pharmacist.
ambulatory. That one's a big one now too. It's really growing, yeah.
Yep.
And what else?
Then I'm trying to, so with industry pharmacy, there's like, I know Hindoya touched on it, but there's different parts of industry. So and development and research, clinical trials and study designs, that would be another part of role of an industry pharmacist. Regulatory affairs is another one. So pretty much you have to make sure that you're abiding by FDA, EMA. There's different organizations that you have to abide by just depending on what your role is and what facility you work at. And there's quality assurance and control, medical affairs and scientific communications. That's another role of an industry pharmacist. So they pretty much can have to make sure that the data is understandable for the general public, and they have to be able to share the data with physicians where you're not getting too into the nitty gritty, but they have an overall picture of what it is, because pharmacists are considered the medication expert. So we know the drugs, we know the pharmacodynamics and the pharmacokinetics of the drugs. We have to be able to let that be portrayed in a way that is understandable by the general public, pretty much.
Exactly.
And then pharmacovigilance is pretty much just drug safety monitoring. So after a drug is like, this is pretty much post-marketing. So after a drug is on the market, look at the adverse effects, see if there's anything that you need to do a drug recall for. So that's just one of the parts of industry pharmacy as well.
Yeah. And it kind of like that also applies to the other fields as well. If you're wondering like how can a person be like a veterinary pharmacist, like you would be involved in, you know more about the drugs and you know more about how these drugs work. So your role would be like teaching how to use these drugs and teaching how, like, what is the best medication option for each situation. I will talk a little bit more about that as we go through the presentation too. With like starting with the roles and responsibilities of a pharmacist in each field that you go into. So we have
this part. So role of pharmacists, like I said, they're the medication experts. So we want to make sure that we're dispensing and compounding the medications accurately. Like I said, with pediatrics, a lot of times doctors aren't really giving the right calculations or dosage forms, and a lot of drugs are dependent on the patient's BMI or their kidney function. All that we have to kind of take into consideration when we're looking at dispensing a drug. Patient counseling is an important one, and it's required legally actually to offer patients counseling after every prescription. If they deny it, that's fine, but you have to at least offer patient counseling. And that can range from showing a patient how to use an inhaler to help improve adherence, or helping a patient figure out how exactly to administer their diabetes medications. And then in clinical
Dosing
therapy
too.
management, Hindo, you can talk about that one.
Yeah, so with clinical therapy management, for example, clinical pharmacist in cardiology, let's say. So, for example, my professor who's teaching us right now, he's teaching us in school while he's involved in a clinic where he works with heart failure patients, and he helps them with the therapy for their heart failure medications, and like how well they're tolerating their medications, if they need to change anything about their medication, if they need more drug or less drug or something different that's not working well for them, and kind of just monitoring them. So they're continuously and actively monitoring these patients alongside their doctors as well. So they're working in a team together, and basically the role of the pharmacist will be everything involving their medication therapy and what's best course of action for them. And it's not just in cardiology, it could be anything. Almost every field a specialized doctor is in, there's a pharmacist who's also part of that team. And medication therapy management is, it's kind of similar to clinical, but like in the pharmacies sense, like CVS and Walgreens. This is something you guys wouldn't know that pharmacists are doing there, but they're actively looking into their patients' profiles and seeing if they're being adherent to their medications, if they're tolerating them well, and they're basically they would contact their patients to see, hey, if they're on a diabetes medication and they haven't refilled their insulin or whatever diabetes medication they're taking in a while, they're gonna go reach out and see what's going on. Did they stop it because it's making them feel not so well, or they just can't afford it or something like that. So their job is to basically make sure these patients are taking their medications the way they're supposed to and sticking to it. And sometimes pharmacists can advocate for patients too, in the healthcare field, in ways where patients can't speak out for themselves, to kind of make sure they're getting the best treatment and attention they need to promote their health, and also promote their health and disease prevention through community outreach, through immunizations, health screenings in the pharmacies. Like, for example, give them advice basically on how to do better in their life. Do you have good examples, Suha? Can't think off the top of my head.
Of like interventions?
Yes, good examples of interventions.
So, I mean, obviously, when people come to the counter at a retail setting, you're helping figure out what medication works for them and what doesn't. So, if a patient comes in and they have like uncontrollably high blood pressure, they don't want to steer away from the Sudafed. I'm going to try to find an alternative that can help control their symptoms and at the same time provide them relief without harming them. So interventions that are over the counter, those are more prominent, I would say. But definitely there's interventions daily, like when you're getting they're dispensing medications. So, but other than the interventions that you do like behind the counter, I would say like OTC stuff is a good part where pharmacists help. I'm trying to think of like what else specifically in the retail setting.
Also like community outreach, kind of like some like in school right now, they allow us to go into events. For example, I did this one event where we went to a church and it was where older people came in and they're just living their life normally, and we did check their blood glucose and their blood pressure, and if they're as they're coming in and we see if their levels are normal or not, we're teaching them about what's normal and what's not normal. And if we see anything if for example, their blood glucose is too high, we could like look more into it. What's the reason? If they're eating too much sugar or something, is it something lifestyle related? Is it something that they're not aware of? And that's kind of like how we can reach out to them in the community and maybe help them be more aware of what's happening. And then maybe if there's something that needs to be done about it, definitely take action. And there's a lot of events like that. Yeah. Some events like that, or like clinics, or like pharmacists in the community like always hold stuff like that through organizations to kind of reach out to these types of populations of people who are not actively taking care of their health per se. I don't want to really say not taking care of their health, but not paying too much attention to it. And we can kind of like help them become more aware to prevent diseases or prevent things from escalating to worse conditions. Yeah.
Yeah, no, definitely. And then I know the American Pharmacists Association, they hold the like annual flu shot clinic. I worked with them a couple times on that. So flu season, which is around this time, is the worst for pharmacists just because they're vaccinating against the flu, but also everything that they typically vaccinate against. So it's just more of a workload. But I know the APHA has a lot of different opportunities for pharmacists to help out in the community. And during my time at my school, like I would say my third year, I think it was my third year, yeah. I worked with something called the SOAR Clinic. So that was pretty much a clinic that offered, it was on a volunteer basis it was physicians and pharmacists. And we were working with patients that were uninsured or underinsured. And we would provide them like free healthcare. And my school was in a very rural area. So a lot of these patients hadn't seen a doctor in like 10 years. So my role was the MTM leader at that clinic. So I was responsible for making sure the patients were adherent because a lot of them came in with chronic diseases they didn't know they had. So just small things like that can go a long way for patients that pretty much have neglected their health for so long, and you're trying to play catch up at this point, or you're trying to make sure that no more harm is done. Pharmacists play a pretty big role with that.
Yeah, and it's all like volunteer basis, really. And that's really a good way to make a difference, in the community. Yeah. And then we also have research and drug development. So I kind of touched base on that earlier. But you can be like doing a role in pharmacy that's not related to research, but also be involved in research, or you could just do that as your main thing and be involved in drug development. I'll give you an example, like my professor, a different professor who's in academia, but he was involved in a research where he developed a type of inhaler that works better for younger infants, So you can always be involved in stuff like that that could make a difference, and you never know, it goes a long way. Yeah, okay. So, the impact of pharmacists in healthcare, they can make a great impact in so many different ways. You can improve patient outcomes through reducing medication errors, improving adherence. So improving adherence, we keep repeating that because it's really important for patients to make sure that they're sticking to their medication if they have a chronic condition like diabetes or blood pressure, to prevent their diseases from getting worse. And
Yeah, or
ensuring their,
for
go
that,
ahead.
like if you sometimes with certain drugs, if you're not adherent, you will not really reach a point where the drug is effective. So with SSRIs, which is a drug class used particularly in depression, that takes the drug about 4 to 6 weeks for it to be effective. So you have to continuously take it until 6 weeks for you to maybe feel that it's effective. A lot of patients don't know that. They take it for a week. They're like, I don't feel nothing. They stop it. They tell the doctor it's not working, but you didn't really give it enough time for it to work. So that also plays in with adherence.
Yes, and also reducing medication errors in the pharmacies. There's a lot of times where doctors send in prescriptions that have errors in them that could be fatal to the patient. And that's where a pharmacist can take action. For example, they can send out sometimes medications that have something the patient is allergic to. And I've seen that happen a
I've
lot.
seen that a lot. You'd be surprised.
Yeah. Or the dosing is off. Maybe the dose is too high for them if they're just starting on it. Or if that dose doesn't even exist, that happens sometimes too. Or
Make a lot of phone calls.
yeah, so there's a lot
doctors,
of
like,
that
what
stuff
is
that
this?
happens. Yeah, the pharmacists are always talking to doctors in the pharmacy. You don't think that's happening, but it's happening a lot.
Yeah.
And also like ensuring safe, also with their directions. Sometimes they write the wrong directions for a medication that could be really problematic for the patient too. And ensuring the safe use of these medications. So we're teaching our patients, hey, if this is how you should take your medication to make sure it works best for you. Like for example, if they have to take it before they eat or after they eat or at night, and advising them what or of stuff to avoid having or eating or drinking. Sometimes we have to tell them this medication can't be taken with this types of food like dairy products or like acidic products and stuff like that.
You'd be surprised. Some drugs have like very particular directions that you have to follow. Like for example, there's a drug, ibandronate. That drug you have to sit up upright for 30 minutes after taking it, or it's gonna mess up your esophagus. Things like that, you have to make sure the patient knows. And that drug is for osteoporosis. So a lot of times that's for older patients, and they can't handle any more illnesses or complications. So that's definitely something that pharmacists have a huge role in preventing any adverse reactions, any complications for the future.
Mhm. Yeah. And like they're also always actively working with other healthcare professionals to make sure the patients are getting the best medication option there is for them. For example, sometimes doctors can call the pharmacist to ask, I want to put this patient on this medication, but they also need to take a different medication. Like how can they both work together? Like whether if it needs to be spaced out so both medications can take effect the way they should, or if they're contraindicated, meaning they can't be used together. So we have to find a different way to treat the both conditions that they have, because there's a lot of options out there that sometimes doctors can't think of or not are really sure what to do with it. So that's where pharmacists can make a difference. And
Also
enhancing
with
access.
pregnant patients, I would say.
Oh yeah, you
A
see
lot
that.
of times
Mhm.
doctors would not know the patient is pregnant quite yet if they're early on. And the pharmacist will look at their profile and see, oh, you have a prenatal. Are you pregnant? That's actually one of the errors that I caught it was a pregnant patient. She had prenatal, so and I figured she was pregnant, and after I asked her, she confirmed. And then she was prescribed an antibiotic that is contraindicated in pregnancy. So that would have caused birth defects for the fetus. So a lot of times things like that, pharmacists are quick to catch. And it can be difficult because we're not in one specialty. Like we have to know vet drugs, we have to know cardio drug, we have to pretty much know all the drugs, dental drugs. So we kind of have to know which drugs are used for which scenario. I know for like dental endocarditis, where it kind of like leaps in with cardio, like we see that, but like it's different dosages for different indications. So we, in addition to knowing all the drugs, we have to know how it's prescribed for different indications. So that's where it can get a little complicated, I would say, with pharmacy.
Yeah. And enhancing access to care. When you have like a pharmacist is like your first point of care in the community, and it can be for anyone or anybody who doesn't have insurance or is underinsured. And that basically saying that when you have a acute condition, something small going on, you go to the pharmacy, and that's like the closest thing you have to a doctor that you can ask on how to treat your condition, whether it's an allergy situation or like something small as you burning yourself, or a flu situation, or stomach bug, something. So you can go and talk to your pharmacist about that, and they can help you figure out whether you should a simple OTC medication can fix that, or if you need to go to the doctor and get more looked at. And serving as accessible healthcare professionals in the community in rural areas, like a lot of the stuff that Suha was talking about earlier with her experience. And reducing healthcare costs through a lot of times patients come to the pharmacy with prescriptions that they can't afford, and pharmacists can provide, sometimes they can talk to your insurance for you, or they can talk to your doctor to kind of give you a cheaper option if you are paying out of pocket, or if your insurance has a high copay for it, they can look into that stuff for you. It's a lot of times patients don't even know that this happened, because the pharmacist kind of automatically looks, hey, this is how much they have to pay. If it's like an outrageous number, they can kind of see what they can do about it, whether they can give them a generic versus a brand option that's more friendly for their insurance to cover, or if they can provide coupons or something like that. And also through preventative care. Sorry guys, the light keeps turning off. So how can you take over here? 1 second.
Okay, so preventative care, that's pretty much the immunization stuff that I was talking about earlier. I did want to add with the helping with cost. A lot of times, like she said, we are dealing with insurance, which is my least favorite part from when I worked in retail, because that's not what I went to school for. I do not want to talk to insurance all day, but that kind of comes with the position if you're working in a retail pharmacy. I will say there's an app called GoodRx. I don't know if anybody's heard of it, but that's a very great resource. If your medication is expensive, you need to download the GoodRx card, and it will have a BIN, a PCN, and a member ID number, which is in place of like your insurance card. And you'll present that to the pharmacist. Call them before and tell them you have a GoodRx card before they process it through your insurance. And then sometimes it's even cheaper than your insurance. So that's something I always like telling people that are uninsured or underinsured, or my patients. There was a dad that had his little girl had asthma, and her inhaler was like $400 with insurance. So I was like, listen, we're gonna get a good RX, and we're gonna try to see if this helps, and it did help her actually. So that's something I like to offer. A lot of retail pharmacies have an in-house coupon, so sometimes they apply it without you even knowing. So
Yeah,
it's just
a lot
something
of
to throw out there.
them knowing, yeah. With good pharmacies.
Mm.
But also there's a lot of times where drug companies send coupons also to the pharmacies, and they can use that for specific medications. And it's kind of like a promotion thing as well, like promoting their brand, but also it's also to help medications who are on certain patients on certain medications. Did you really talk about the managing and preventing how
Yeah, so managing was just, I just talked about how we were focusing on immunizations with that. Promoting safe drug use would be referring people to there's drug take back programs. I know like the police station has it, or the fire
Ye-
department, one of them has it. Like every year they have a program where if your drug is expired or um, you're not taking it anymore, you can dispense of it that way.
We actually had an event for that in school last week where we go outside in the community and we advertised the event for like a few weeks before, and so many people in the neighborhood came and just gave their old medications back, or just some whatever vials or bottles they had at home that they're not using anymore. Because a
Yeah.
lot of times they don't know what to do with it.
Especially so like in addition to that, so I worked at a pain management clinic where we were pretty much handling opioids. With those, you have to be very careful how you dispense them. You don't want to just throw a fentanyl patch in the trash and the child picks it up because it's absorbable through the skin. So definitely at the pain management clinic, that was something that we talked about a lot with patients. There is something called Dispose RX, I think, where it's like a little packet. You open it and then it dissolves the drug and it gets rid of the active material. And then that way you can dispose of it that way. I know we gave a couple patients that were prescribed some pretty hardcore opioids.
Okay. Oh, and maybe we could stop here to ask if anyone has any questions. I forgot to say if anyone has questions, you can stop us in the middle. And if not, we can wait till the end. Yeah, no?
Let's
Okay.
wait till the end, and that way.
Okay, no problem.
Okay, so I'm going to talk more about the education and licensing requirements. So you have to have a doctor of pharmacy, and that's typically a 4-year post-undergraduate program. I have seen some programs that are 3 years, but I think there's only a handful of those. So you have to complete the prerequisites to apply, and you apply through FarmCast, which is its own portal where you select the schools you want to apply to, you input your essays, your personal information, all that good stuff. For after you graduate, the licensing requirements, so you have to pass 2 exams in order to be licensed. So the first one is you have to pass the NAPLEX, and that's the North American Pharmacist Licensure Exam. That one is, you take that exam once, but you also have to pass the NPJE, and that is the law exam. And that one is specific for each state. So you take the NAPLEX, so say I want to practice in Virginia. So I'll take the NPJE for Virginia. Then let's say I move to Ohio. I don't have to take the NAPLEX again, but I will have to take the NPJE for Ohio. So I did take both of these. The NPJE was, I forgot how many questions, but definitely you really have to study hard for these because they're both timed, and you have to know your stuff, and you have to know the federal law and the state specific law. Sometimes the state and the federal law are not exactly aligned, so you always have to go with the strictest option. So Ohio has a pretty strict, well, not, well, somewhat of a strict MPJE when it comes to their state laws. And then I did look into the foreign graduates and how they would be able to apply for the NAPLEX and MPJE. So they have to apply for a certification through the National Association of Board of Pharmacy. And this certification pretty much confirms that your education from your university where you attended a pharmacy school abroad is equivalent to the education here. So I don't know how they run this process, but I know you have to apply for that certification and get for that to be approved. And then you have to pass the FPJEE in the TOEFL exam. So TOEFL is just like testing your English literacy pretty much. And then I think the FPGEE is just to see what you know and if you can sit for MPG and NAPLEX. In addition to that, you have to complete your internship hours. I know for me and other pharmacy students that study here in the US, you typically complete these hours your final year, so your 4th year of pharmacy school. That's when you're on rotations the whole year and you're going into different fields of pharmacy. The internship hours range from 1,000 to 2,000 hours, depending on what the state requirements are. So after you've completed the internship hours and all the other examinations, then you can sign up for the NAPLEX and MPJE. So it's a pretty long-winded process, but I think it's worth it if you've already graduated from pharmacy school.
And I wanted to share some study materials just to kind of show how the material is presented to us, or like what we have to learn. Let's see. Can you guys see the screen?
Yes, we can see it.
Okay, cool. Okay, so this is one of the clinical modules we do. So we do clinical modules, kind of like when Suha mentioned that we have to know a little bit of everything. So we just recently did this one, the cardio module. Basically, let me see, where's the objectives? I guess I could go through these. But I wanted to just show you guys like what this stuff kind of looks like. So we learn about like what is heart failure, the pathophysiology of it, and epidemiology sometimes, but the causes, like I said, and how the disease works, how it affects the body, or how it can progress, and signs and symptoms, and how the patient can be diagnosed. And the reason we have to know all that is because we have to kind of like also for us to be able to know which medication is the best for the patient, we have to know what this disease entails as well and how it works. So we kind of have to learn all that stuff. I wouldn't say in deep detail, but detailed enough. And I want to see if I can get to like the drug part. Like for here, for example, how heart failure is classified, so we can know how bad or what stage of heart failure that patient is in, and how to treat it. This is basically the gist of it. The key drug classes, which drug classes there are, and if it's like which medication is the best for them, and different treatments and how they should start with it. All these different, sorry, these are blocked off because I'm trying to memorize them. But yeah, these are all the different drugs that you can have patients take, and based on what they need, based on what their symptoms are, and all that stuff. So I didn't know what to imagine the material would be like, but this is a lot more than what I thought I would have to learn. but it also makes sense. At the end of it, it made sense for me to like be able to know which medication is the best for this patient. I have to know what they're going through. I can't just suggest a medication just solely based off knowing what this medication is. You have to know what it's used for. You have to know when they should be taking it, or what their next medication that they should be taking if their disease is progressing to the worse, or if it's progressing to the better. I have to know what's happening to be able to know what they can take off their list. And we're just in the ends of this module, which is basically all about endocrinology. So we're learning here, for example, about thyroid issues and thyroid medications and the different thyroid situations, hypothyroidism, hyperthyroidism, how it works, and all these different medications. This is a study guide that I made just to show you what the material kind of looks like a little bit. I know nobody's gonna know what all this stuff means, but it's just kind of to give an idea. The fun stuff is lab. So in lab, we kind of do stuff like simulates real life kind of as best as they can, kind of to give us practice. And it's really kind of like aligned with the school material. So for example, this one in lab, they simulate a fake patient, someone's pretending to be a patient, and we have to like interview them. They come in with a health condition or a bunch of health conditions, and they have a main complaint. And so we have to figure out what's possibly going on wrong with them. So we're going to ask them about their medication history and how they're taking their medications and what symptoms they're experiencing. And they'll answer all these questions. And you kind of have to just interview them through that stuff and basically kind of come to a conclusion. Hey, I think maybe you're taking this medication wrong, or I think you could be experiencing something that you need to go see the doctor for, or if it's you're taking something that's contraindicated with your medication. So we have to learn how to interact with patients like that, applying our knowledge as we're going through the material. And there's also simulations of RX review. It's kind of similar, but this one's more like there's no patient interaction here. You're timed into figuring out, reading the patient case scenario. So you're gonna see what the patient is going through, all their medical conditions and their history and what medications they're taking. And this is kind of to have you practice how to be able to spot errors really quickly. And that's the whole purpose of this, and to kind of save a patient's life. Like if they're having really bad symptoms or whatever they're complaining about, we have to figure out quickly what's happening with them. So these are different ways that they teach us all this stuff at school. So you can see it's kind of comprehensive into the patient's conditions and stuff like that. And it's really medication focused, but at the same time, I just wanted to show that you really have to understand the health conditions too, and what could be going on wrong with them. Yeah. Does anyone have any questions about these stuff? No? Okay. We can keep going on. Okay, so I'll tell you guys a little bit more about the application process. As far as I can remember, the application window is around July, or like usually like late summer or midsummer, maybe I'd say midsummer, yeah, and all the way to the winter time. So there's the early applications, and then there's also like some schools, some programs have late application windows, which goes through from January to March, and the early is July to November. It really depends. This is a really big window, but each school has different deadlines. So whatever school you're interested in, you kind of have to just go and see what their deadline is. Early applications are better because you can know early on where you'll hear back by the winter time, like December, January max, if you're what school you got into. And you'll be required to do 2 to 3 letters of recommendations, and it can be from your teachers or your employers. And you'll do that through the FarmCast portal that we mentioned earlier. So you just sign up and create an account for that. And the portal has like background information, like the demographic stuff, and like that basic stuff you have to fill out. And then you'll fill out like your transcripts and the prerequisites that you did. And then you request your letters of recommendation through that, where the person you're requesting a letter from gets an email. And then that's all you have to do. Once they finish it, it will just say complete on your portal. And then there's also a short essay that you have to do. These are not anything crazy. They're usually just stuff about like you sometimes. Most of the time there's stuff about you, like kind of to show who you are. But some schools require specific ones too. And in the portal itself, as you're selecting the schools that you want to apply to, it shows you what their specific requirements are. And if sometimes they'll require specific essay questions that you have to answer, and it'll be prompted through the portal. So everything is through FarmCast. You won't have to do anything outside. And then after you
Add as well, with the essay, you kind of have to be careful what you say, and you have to kind of know it well, because I know during my interview, the essay was brought up multiple times. So I did talk about like my leadership experience with creating the international festival N2 State. So I remember that came up a lot. They talked a lot about my experience working in a retail setting. So just make sure that you make yourself look really good on your essays, because they will read that, and it comes up in the interview where they bring all that stuff back to you and ask you more in detail about it. So just definitely be prepared for that during the interviews.
Yeah, and you'll also be able to add your experience too, like if you have any certifications that you did or licenses, there's places for you to add all that in over there as well in the FarmCast portal. And then after you submit it, you typically get offered interviews through email or through phone calls sometimes. And these usually happen through around like 2 to 4 months from the application time. From this whole process takes about 2 to 4 months from the application time, not just the interviews. You'll get interviews pretty quickly after applying, like maybe 2 to 3 weeks. It really varies. I don't want to say something firm.
Each school I think is different. So with mine, I remember I got like my phone call in October, and I interviewed early October, so I think I got my phone call end of October.
Mhm.
So yeah, some
Yeah.
schools are quicker than others for
Yeah,
sure.
some schools do it quicker. And also with like, for example, some schools that interviewed me, they'll literally call me the next day, be like, hey, you got it. Or sometimes you can wait a few months to see. Maybe they're waiting on everyone else to interview. So yeah, it can be super quick, but sometimes it can be slow. But it never takes longer than 2 to 4 months. And then after that, you just wait for offer letters and you'll see what school you want to go accept. I put in a few school like programs that are in North Carolina that are well known. There's Wingate. I forget exactly where that's located. There's also Chapel Hill. They have a pharmacy program. And Campbell, I think Campbell is like in between Raleigh and Charlotte, maybe. I think somewhere near Charlotte, I believe. Um, and then there's High Point University. Yeah.
Yeah. So why pharmacy and why you should consider it? So pharmacists play a critical role in healthcare, and they are in charge of safe medication management, patient care, and they help with public health in general. Like I said, during the COVID pandemic, they really stepped up, and now there's a lot of initiatives to where lawmakers are giving pharmacists provider status. So having the ability to prescribe certain drugs or refill certain drugs. Pharmacists are also versatile professionals. So like we talked about the different career paths, there's various settings in which they can work and contribute to the well-being of the society. And it's also a quickly expanding and flexible career choice. So just like we talked about, there's so many different ways that you can go into pharmacy, and there's so many different career paths that you can choose. And it's more than just the retail setting that people are accustomed to.
Yeah.
All right.
And
And what questions do you have for us?
anything.
Thank you for very good presentation and information. I was wondering if you could talk more about any scholarship opportunity.
Oh yeah, sure.
Yeah,
we-
given like, you have to do like postgraduate to be an official pharmacist. So like if there is
Yeah.
any scholarship undergrad or maybe postgrad?
Yeah, undergrad there's more like financial aid opportunities, I would say, and scholarships. But with postgrad, I noticed that most programs have scholarship offers because there's not really financial aid per se, like grants, there's only loans that you can get. So the programs are usually super generous with giving you like an admissions scholarship, and like as soon as you're admitted they give you like an offer. But also within the schools itself, every semester they give you scholarships that they have sponsored by other people that you can apply to. And there's so many opportunities. You kind of just have to really go and do it, like apply for them
Yeah,
after
each
the
school has
admissions.
its own for sure. I would recommend that the schools that you apply to also apply to all the scholarships that they have.
Mhm.
And then from there, kind of just go with which school gives you the most scholarship
Yeah.
money. But definitely there isn't really any financial aid that helps that much. A lot of times people are either paying out of pocket or depending on loans. But each school does have scholarships that help a lot. So I would definitely look into the specific school-based scholarships for each program that you're applying to.
Yeah, but I wouldn't say like a lot of them are paying out of like you have, if you are not able to pay out of pocket, there's definitely loans for you to take, and they're
Yeah.
easy to get through school. So you don't have to worry about that. Like you don't have to worry about not being able to pay for the school, because you will get all the all the what's it called, loans you need. But to avoid being in loans, you just kind of have to apply for the scholarships to add to whatever the school offers you through admissions as well. Yeah, they're always like also promoting them too. And whoever you can ask in your school, you can always apply for the scholarships that they have out there.
I just have a question. Assalamu alaikum rahmatullah.
Alaikum assalam.
I'm so proud of you. You are my daughters, mashallah. I'm glad.
Thank
يعني
you, thank you.
mashallah, والله, it was like great يعني presentation, mashallah. The question I have, mashallah, being an interpreter in the community, I know your role as a pharmacist, and you mentioned, yes, you're helping with medications. And I just want to know your future plan on helping others. Like I know you encourage today people to enroll and be pharmacists. I hope we have more than two today, but I know some people have something to do, you know, the participation, not that a lot, but it is very interesting. So what is your plan for contribution to do for the community? Like I know my question, sometimes people, they don't have access to know, like even the Medicaid may give them a hard time. I don't cover, especially people they have like diabetic people or blood pressure. Or what is your plan as a pharmacist to help with getting access to this medication in a good rate for people who are in need? And this is not part of the participation, like the presentation. I just want to know that, because if you can add that to the slides, encouraging, you know, those generation youth to be enrolled in the program, and that's going to be helpful. We have more people that can help with medication. So why I mention it, because I remember Suha talk about the inhaler. And I know that being interpreting for the community, people cannot afford buy the inhaler, and they have asthma, have nothing to deal with. So what do you think that what you can do to help getting access? Are you going to continue finding resources for people to help them, like as a pharmacist providing this type of medication, which is very costly and hard for people to handle it? That's my question. And I want you just to add for the presentation, if you can next time. I agree with the guy who said about the financial, like the internships and no scholarships, I mean, and some people can sponsor, you know, some people who want to do this kind of field. Just add resources to your presentation to make it, you know, very helpful more. And that's what I need to share. Thank you very much.
Thank
I
you.
enjoy being
Thank
with
you.
you.
Thank you
All
so
right,
much for the
thank you.
feedback.
All right, you are welcome. Thank you.
Yeah, so in terms of pricing for medications, pharmacists don't really determine that or dictate that. That's pretty much insurance. So that's why earlier when I was saying that insurance plans, we're always going back and forth with them, trying to get the best deal for the patient. So the pharmacists are typically working really hard, either using different coupons or trying to find the best ways to reduce the price, whether that's splitting up day supply or whether it's looking at helping the patient apply for like a manufacturer coupon. A lot of medications, you can apply for a manufacturer coupon. So you just go to the back of the box of the medication and it'll say the manufacturer, like who made this drug. And if you go to their website, sometimes they have as little as $0 copay for certain drugs. So that's definitely something I would look into. Additionally, the GoodRx app, I talked about that earlier as well. So if you download GoodRx, it's a great app that can help reduce the price for patients that have very expensive medication. So I would definitely look at GoodRx. It's a simple app. You just download it, go in, and then type the name of the drug. And then after you type the name of the drug, you put the strength of the drug. So if it's 5 milligrams, 10 milligrams, whatever it may be. And then afterwards, they'll give you all the pharmacies that are nearby and the price of the drug at each pharmacy. So that's definitely a resource that I always recommend to people to kind of make medication more accessible. I'm trying to think what else. In terms of insulin, I know diabetes medications are pretty expensive. Walmart pharmacy actually has a program where I think it's $25 for certain insulins. So that's definitely something I recommended to patients where their copay for their diabetes medication was just astronomical. So certain insulins, Walmart pharmacy might be a better fit than CVS or Walgreens or Rite Aid. So I would look into that. And I don't know, Hindoy, do you have any other ways to make it more accessible and affordable?
That's basically it. That's the majority of the ways that you can help patients have like a cheaper option for medication. Yeah.
But I definitely get the sentiment that it's very difficult. And a lot of times we struggle with that as well, because we don't want to ever have a patient turn away because they can't afford their medication. So we really talk to the insurance and do what we can and provide the resources to help make it affordable.
Yeah.
Any other questions?
Thank you guys so much for this informative presentation. I think we can all like say that we definitely got a new like found appreciation of the vast role that you guys play. I had no idea the different roles and hats that pharmacists take on. So thank you so much for that information. Thank you for the role that you play in the community, for really being that safety net for patients and also for healthcare providers and catching everyone's mistakes, and just putting the patient first. My question for you is, if you did a really good job talking about the different roles. So I was wondering if you can kind of take it a step further and talk to us about what are sort of the financial prospects of the different roles that pharmacists can take. I know I hate to be the money person, but it's an important question, right? You want to make sure that when you're choosing a career, you're able to get a return on that investment. So if you can kind of briefly mention what that range looks like for different roles within pharmacy.
Gotcha. So you're definitely looking at 6 figures. It depends on how much experience and kind of what you offer. So if you've done a residency, if you've done a fellowship, if you're in a rural area, you'll probably they need more people, so you'll get paid more. In terms of like different specialties, I know, for example, like in industry, unlike retail industry, like you can kind of move up, but retail typically has a cap. I would say around, well, if you're a manager, maybe you're looking at 150. So with retail, there's $150,000. So with retail, there's typically a cap, but with industry and all these others, I've found that there's more opportunities. But I think that's changing now. I've seen that they have like huge sign-on bonuses for pharmacists. So that's been pretty helpful. But it just depends pretty much on your experience, and networking helps a lot. So make sure you're getting yourself into rooms where you have opportunities that you otherwise wouldn't have been presented with. But you're definitely looking at 6 figures, no less than that, even starting off as a new grad, I would say.
Yeah, like around like I'd say start up with like 110 to 120. And it can go up to like 145, 150.
Yeah, and it for retail, yeah. For industry, I think it's pretty much pretty high, like as compared to retail. You might even go into like 200s. And it depends on where you live. Virginia, their pay is different than what would be in like Nebraska. So just depending on where you live and the standard of living and just the expenses there, you'll be getting paid differently.
Yeah.
Thank you for answering that. I guess a follow-up question is residency required after finishing your pharmacy?
No, it's not required at all. It's mainly for roles that are in clinical, if you want to specialize in a specific part of the clinical field. It's not required at all. There's also something called a fellowship, and that's more towards like specific industry roles. It's kind of equivalent to a residency, but it's kind of more for you to get specific industrial roles. Same process, I think. Maybe a little bit different. I don't know the details of it yet, but residency, yeah, like I said, just only clinical fields, but you know how.
Depending on the program, it could be a PGY1 and a PGY2 or just a
Yeah.
PGY1. And then if you want to like get specialized in, let's say like psychiatry, you would take the board certification exam to get that accreditation so that you can practice as a psych pharmacist. But that would be post residency training. So it just kind of depends on what you want to do. If you want more a clinical role or more of a corporate role.
Thank you so much. And I have one last. before I dictate or give it up to somebody
That's-
to dictate. Oh, Dr. Amani, you go ahead.
No, go ahead, Arid.
Okay.
Then I will follow up.
One last question, I promise. So I know that you guys have, so how you did your PharmD and Hindi, you're also pursuing that. For someone who said like, they'll say they don't want to go all the way to a PharmD program. And I noticed that both of you have some sort of experience as pharmacy techs. So what is the, pathway to become a pharmacy tech? And also what is the pay for that role? So if you can talk a little bit about that.
Okay.
Okay, go ahead.
Well, I think pharmacy techs are very underpaid. They do a lot and they deserve to be paid more. So I'll start off there. In terms of the steps to get into it, you pretty much just apply. A lot of pharmacists are short-staffed right now, so you'll probably get the job within the week, pending like background check and all that. But then you can be a certified pharmacy tech. So that's like an exam. I think they give you like, each company is different, but I think they give you like 6 months or a year for you to take like that exam, and then you can be a certified, and then that way you can get a little more money. Hindoya, you worked as a pharm tech more recently than I did. Do you remember how much like you're looking at?
It was like around, well, I was in Maryland, so it was a little bit higher than North Carolina. In Maryland, it was around like 16-ish an hour. It's not minimum wage, but it's higher than the minimum wage by like maybe $1 or $2, I would say. But yeah, it doesn't require a lot. I've heard of some people who go to school for pharmacy technician jobs, like I don't know, like they do like a year or two, some type of study for pharmacy tech. I feel like those people with a degree might get a little bit higher of pay. And then there's also like senior tech roles who I think I remember those were getting paid around like 20 an hour. It's more like a leader of the technicians in the pharmacy team. And I think that's it. Yeah. It's nothing crazy. Usually it's something like some regulatory stuff, and then the certification, and it's also related to like what you do in the pharmacy, of course. All the details of the jobs.
Thank you so much.
Yeah.
Hello, this is Amani. Thank you very much, Dr. Suha and Hind, for this valuable information. It's really very great information for us as parents and also for the youth. I know my daughter, she wasn't able to attend today's Zoom, but definitely I'm going to let her listen to the recording. It's really valuable information, and even just is going to entice those kids to explore different careers and just think about it. I want to ask about what's your message for the youth who are getting into the undergrad right now, or who are already enrolled in undergrad school and they are hoping to get to, a second level with healthcare career and go to those schools. What is your message for them? What they need to focus on to prepare themselves for this type of schools? Thank
Yeah.
you.
Of course. I give one advice that I feel like that would have helped me a lot while I was in undergrad, and I had to compensate for it, but it worked out well. But my advice is that whatever they're trying to get into, look into the program's prerequisites early, so you don't have to get held back after you already did 4 years of school to kind of like take extra classes to do prerequisites. Usually the prerequisites are not like something crazy, but it's something you can squeeze in your 4 years of undergrad that you can tackle early, just so it makes your application process a lot smoother, and kind of incorporate that into your 4-year plan. What else?
I agree with the prerequisites. I know the schools that I applied to, I had done my research before, and that helped me so much, because some schools that I had applied to, they required things that you wouldn't expect, like beyond
Mm-hmm.
chemistry and biology.
Like
One school
economics, like
required-
you're in biology
Yeah.
and you had to take an economics class. or
Yeah, I had to take economics, a public speaking class. That wasn't even on my radar, but that was a requirement for one school. So if you are in undergrad and you want to pursue pharmacy, the earlier you look at prerequisites, the better. That way you can go to your advisor, have everything mapped out to figure out when you will be done by the prerequisites and when you'd be able to apply.
Mhm.
So definitely I agree with Hindoya with the prerequisites. Additionally, I would look at the pharmacy schools that you're applying to and look at their NAPLEX pass rate. You don't want to go to a school and put all the effort into applying to a school and going through the 4 years for a university that their NAPLEX pass rate is low. So you want to maybe like a school that has at least 85% NAPLEX pass rate from the first time. That's definitely something I would recommend. Let me see, I'm thinking what else.
And if you're undecided of like where you want to go, like what field in healthcare you want to go, I did a pharmacy tech job just to see, like early on, just to see if I really wanted to go into this field or if I want to go into something else. So get out there and like find shadowing jobs. There's a lot. Even if you don't have to work the job, like you can literally go to whatever, if you have connections with someone or like find connections, go and look into what the field looks like, just so you save yourself time after undergrad to figure out what you want to do early on. So you don't waste your time after undergrad not knowing what to do. And sometimes that could take time too, and kind of people just, lose track with what they want to do. Yeah.
Retail pharmacy is a good introduction to pharmacy because it shows you see all the drugs there. You're seeing kind of what they're used for. You're kind of looking at the pharmacist, see what they're doing, what counseling they're doing. So it's a pretty good introduction just to what pharmacy looks like. But then when you go into pharmacy school, just know that you have more options beyond that.
Oh.
So definitely
Thank you.
shadow.
Thank you very much. And thank you, Dr. Rich, for organizing this session. I know it took some time from you and while you are busy with your exams. So thank you very much. And it means a lot. Thank you very much.
You're most welcome. Thank you and all the leadership for the platform. And thank you to our guest speakers for this really engaging session. It's amazing. We went out for an hour and a half. So we didn't get time. So thank you again. Thank you to the participants who asked questions and came and took time out of your Saturday to really come and learn, whether it's information for yourself or information for your kids. We really appreciate it. I know we had a couple of people rolling kind of late. So for those individuals, we'll have the recording, inshallah. So you can get that from Dr. Amani or Dr. Khalid. And we also have the slides. That way you can get that information. I'm also going to plug the future events that we're having. So we'll do a couple more sessions with different speakers on different careers. So we won't have anything on November 9th next week, but we will have another one, inshallah, November 16th. And that one will be on public health. We'll have one on the 23rd. That one will be on physician assistant. And then we'll have a couple more covering dental hygiene, dentistry, medicine. So definitely stay in touch and we'll kind of roll out those flyers as we get closer to the dates. So thank you again. And if nobody has any more questions, we'll close out the session. Jazakumullah khair.
I just want to add one more thing, my daughter Arij. I'm so proud of Suha and Hind, and we have the mom here. I just called them immediately. They were not in the session. I said, go ahead and join. We're so proud of the mom. We want to give them a hand, Manahil and Faiza, for attending. And we hope to see all our generation, mashallah, helping out. I can remember, Suha when she was like 4 years old. And now, mashallah, I'm so proud of all you are here.
Thank you. Thank you so much.
And give a hand for the mom who attending. يعني thank you very much, Faiza and Manahil. and all the mom who working hard to have those generation helping out now. And thank you for Amani and Bet
Thank you to our
Sudan for
parents, our
hosting
community
this
for
type
sure.
of event. I really appreciate your efforts. Thank you very much.
Thank you. Thank
And have a good
you.
weekend all.
Thank you guys for
Assalamualaikum
putting this
warahmatullahi.
together and giving us the chance to give back.
Yeah. Hopefully we can help someone.
Oh, you helped a lot of people, I'm sure. And inshallah, this is just the start. So more to come. Jazakumullah khair, everybody, and ma'as salam.
Bye. Enjoy your Saturday.
Bye.